In 38 states, including Indiana, the cost of childcare for an infant exceeds the in-state tuition of a 4-year public college. Given the exceedingly low odds of a 6-month-old passing a college entrance exam, many working parents find themselves grappling with the same conundrum. Should we stretch our finances or even go into debt to pay for childcare? Or should we quit our jobs to care for our kids? Hi, I'm John Schwannis, and on this week's show, we'll examine that all too common quandary with an eye not only toward the well-being of parents caught in such a predicament, but also toward the overall vitality of our state's workforce and economy. Indiana Lawmakers, from the State House to your house.
Indiana Lawmakers is produced by WFYI in association with Indiana Public Broadcasting Stations, with additional support provided by Par Ritchie.
Limited availability and increasing costs are leading to a childcare crisis in the state. The Indiana Youth Institute noted that Indiana's average cost of center-based childcare for a toddler is more than $8,500 annually. During the pandemic, the federal government gave the state $1 billion for childcare. This has been used to support the Child Care and Development Fund, which in turn supported daycares, preschools, and after-school care centers. Lawmakers in the state declined to use state funds to continue this expansion long-term, leading to the decision last year to freeze child care vouchers for low-income working families until 2027. An estimated 32,000 children were on the wait list as of last fall at the time of the announcement. Early Learning Indiana reported that more than 20% of child care providers within the state depend on these voucher funds to maintain operations. As a result, child care centers across the state have been forced to close as families find themselves unable to pay the steep cost. At the same time, the Indiana General Assembly has loosened regulations for child care providers by removing age requirements for staff, by increasing ratios to permit more children with fewer adults, and by minimizing restrictions on unlicensed home care to serve more children for longer hours. This deregulation aims to attract more individuals to the field. Child care workers nationwide make an average of just $14.60 per hour, making it one of the lowest paid professions. Joining me to talk about child care in Indiana are Representative Carey Hamilton, an Indianapolis Democrat, Representative Danny Lopez, a Carmel Republican, Vanessa Green Sinders, President and CEO of the Indiana Chamber of Commerce, and Sam Snideman, Vice President of Government Relations for United Way of Central Indiana. Now, I'm a few years removed, believe it or not, from child care, but I understand there's an issue here. Some would even call it a crisis. And in fact, at a committee hearing, Ways and Means this week, Greg Porter, Democrat, arguing for 2 amendments that both were soundly defeated, said it's not just, challenges. It's not just difficulties. It is a crisis. Danny Lopez, you happened to be on that committee and were in that hearing. Is he right?
Look, I don't think there's any doubt, and I don't think you're going to get any argument from anybody that this is one of those issues that crushes just about anybody in any community that has kids, right? It's a workforce issue. It's an issue for our companies and our employers, but it's an issue for people across the economic spectrum as well. And it's something that has to be addressed. And we created a cliff inadvertently, but we created a little bit of a cliff, and we're having to deal with that. Obviously, we're in a non-budget year, so it presents a little bit of a challenge, but there are things that we can look at, and we are looking at this session, try to ease some of those regulations and get employers to the table, or continue to bring employers to the table and give them new tools to invest in our families and our kids, because I think Representative Porter is right. There's probably few things that are as pressing as this issue and as significant and consequential for life for just about everybody here in Indiana.
Not enough to get you to vote for either of his amendments, though, right? So
we're working on some really good solutions.
Working on other stuff. All right. Carey Hamilton, same question. Crisis?
Absolutely. Yeah.
And you've said this is an issue that's been near and dear to you. You've been on this very couch talking about it in the past. You say it's critical infrastructure. Elaborate on what you mean by that.
That's right. Well, so first of all, the State Chamber of Commerce actually at the end of 2024 did an economic impact study, and they show that there's a $4.2 billion economic hit every year in Indiana due to the lack of access to affordable childcare across our state. So clearly, that's infrastructure that we don't have. right? I mean, families rely on childcare to be able to go to work, and we don't have access to it in so many of our communities. And folks who even have access often can't afford it. So thus the economic impact, that big hit. And that study also showed there's $1.1+ billion in lost tax revenue that's part of that economic impact.
Part of the overall.
So imagine if we invested just a small portion of that $1 billion every year in shoring up that child care system so that there's more access in our communities and it's more affordable, so that we treat those providers as the professionals that are trained and that are compensated appropriately as the educators and caretakers for our youngest Hoosiers.
There's so many numbers and stats and figures we could employ in this conversation, but I'll try to remember we're talking about kids and humans. But we talk about $8,500 on average, the cost for Hoosiers paying for child care. $12,000, I think, is the figure for infant care. We could talk about the thousands of people on waiting lists. We could talk about all of these things. But that $4 billion has gotten a lot of mileage, 4.2, if we're getting the full amount. Again, that was the U.S. Chamber a few years ago came out with that. Is that resonating with lawmakers when you say, hey, look at this figure? This isn't just about struggling Hoosiers. This is about potential loss to the state.
Yeah, I think definitely. I think you have to put it in economic terms to kind of, help the conversation move forward. And that was a study that, as you mentioned, the Indiana Chamber, along with the U.S. Chamber and Early Learning Indiana, did together to quantify the importance, as Representative Lopez said, of this issue. And for us, we hear about it all the time from employers because it is keeping their workers from coming to work or staying at work or coming back to the workforce after they've had kids. And we all know that talent and workforce is key to Indiana's future economic success. And so this is an issue that we got to work on.
And of course, Sam, this is an issue important to your organization as well, approaching it perhaps maybe not from the business perspective, but from the human services perspective and the needs in our state. How do you size this up?
Yeah, absolutely. I think that when you look at these cost figures for childcare, right, our state's median wages just haven't kept up, right? And so most people are paying on average more than 10%, more than 11% of their incomes on childcare when they've got kids that need care. That just puts a significant strain on individual households. What we're also seeing are the nonprofit providers and really even the for-profit providers that are really struggling in this moment. We've already lost 200 child care providers really since the re-implementation of the CCDF wait list in December of '24. And, thanks to some surveying by Early Learning Indiana, it seems like we may lose an additional 10 to 15% of our capacity over the next year if some things don't change. And what that means for households, whether they are subsidized through CCDF or On My Way pre-K, or whether they're self-pay families who can afford their own care, is that when providers are in trouble, that has downstream impacts to households and then further downstream impacts to the employer community.
And just to dive into a few of those numbers, here I said I wasn't going to get into numbers, but you mentioned 7 or 11% is the average impact in terms of the household income being expended on these needs and services. If I'm not mistaken, U.S. Health and Human Services says the target should be no more than 7. Is
Correct.
That so?
Yeah. So, and in many of our households, right, that number is much higher than 11%, particularly when you add additional children into the mix. It becomes prohibitively expensive. And so as you've seen in the Chamber's research and research elsewhere, many people are opting out of the workforce because it just doesn't make financial sense. And often it is women, it is folks who are of lower incomes and who can't afford to take these hits that are bearing the brunt of the fiscal cost.
And John, I think that Sam makes a really important point, and I think this is why we have to look at this holistically as opposed to just thinking about how do we cut another check year after year into the system, which, again, as we head into the budget next year, we're going to be looking at how we close that gap from a fiscal standpoint. But it kind of reminds me of the way Fred Glass speaks about food insecurity at Gleaners. You've got to deal with the crisis, right? You've got to deal with the issue facing our families, and then you've got to shorten the line. And I think, we've got to continue to do things to get wages up, right? We've got to do things to continue to cut regulations to bring the costs of providing that daycare, that childcare down. So I think it's really about looking at this holistically, and that's a lot of what we're doing. Thinking about how we get employers new tools. These are the kinds of things that I think we have to be focused on this session as we ramp up into January of next year.
And when you say it's not just about writing a check, and you mentioned earlier when the first time around the panel here, you talked about being at a cliff. We're suggesting, I take it, that there was too much willingness to write a check, perhaps during the pandemic when federal dollars were flowing, but those were one-time dollars, and is that the cliff you're?
Yeah, but I wouldn't classify it that way. I mean, I think at the end of the day, we made significant investments during the pandemic, rightly, I think, in our families, but the dollars were flowing. But when those dollars dry up, there has to be a plan, right? Because you just can't sustain that indefinitely over time. And so I think what we're dealing with now is the result of that. Escalated enrollment, escalated in the vouchers, escalated funding for that. But once that dries up, then where do you go? And that's what we're sort of grappling
with. And let's talk about digging into some of these solutions. Carey Hamilton,
so
go ahead.
I would say, first of all, just think about families, but at all parts of the economic spectrum. Right now with the CCDF wait list that we've created, that's more than 25,000 families that suddenly don't have access to childcare. These are the lowest income, hardworking families, and they're, really, really struggling. And then at the other end of the spectrum, we have folks, say in the suburbs around Indianapolis, waiting 12, 18, even 24 months for access to childcare in their communities. They can't even get in the door. So that's kind of the crisis we have, let alone can they afford it.
Is that because the dollars aren't there, or because the facilities aren't there? I know I've seen data that suggests that there are 2/3 of the counties in Indiana that are essentially a desert.
A desert, that's absolutely right. So we have to tackle this from many perspectives or angles. We clearly have deserts, right? That's you just said the statistic. So how do we build up that, again, basic infrastructure? I want to point to, this really crisis in our state. Lots of states have been trying to figure out how to deal with building out childcare infrastructure, and they're coming up with solutions. They're coming up with targeted investments. They are making investments, but very strategic targeted investments in different parts of the system to lift it up, to make sure that those workers are paid decently so that they can support their own families, so that maybe they can even afford childcare themselves, John. Imagine that, our childcare workers being able to afford childcare. And having access to affordable health care. These are some of the tools that different states are employing. But I want to point back to CCDF. It's critical to remember
Which is the fund, the Child Care Development Fund.
For the lowest income families, Child Care Development Fund. If a year and a half ago, if you were eligible for that fund, very low income working parent, you would have access to affordable child care. Today you do not. 80% of that investment is federal dollars. So when we don't match, we're turning away a major federal investment in that basic infrastructure. I think that's a mistake.
Lots of states are doing things. Some are capping the amount that a household can spend. Somehow, New Mexico, if I'm not mistaken, actually was the first state in the country to say universal child care, not only for parents, if you're a grandparent and you're taking care of kids, sign you up. It's free to all comers.
Yeah, well, I actually want to talk about an example here in Indiana, because I think, as we've all mentioned, this is just an issue that we have to be really creative on and think about lots of solutions and think about it holistically. I mean, back to Representative Lopez's point, I think we increasingly think about it not as childcare, but as early learning and the start of a child's education, which is going to pay off not only for that child, but that family, Indiana, the workforce. And so again, I think thinking about it more holistically, but also we have examples here in the state, the Northeast Indiana Early Learning Coalition up in Fort Wayne has a pilot going, a tri-share model, where they're using kind of economic development grant as a piece of the funding. Parents are contributing, and then employers are contributing to, again, close that gap so that those kids can, go to daycare and get that education. And they have, I think, close to 150 kids enrolled, 17 employers. And again, it's a pilot, but I think it's just indicative of how we're all trying to roll up our sleeves and figure out how to do it.
Kind of the model that could be.
House Bill 1177, which
You're a co-author.
I'm a co-author on. Representative Cash has worked on. Very passionate about this issue. Actually gets to at some of these issues that Vanessa has cited. I mean, how do we allow local economic development actors to tap into TIF, as an example, to use in providing childcare in their communities?
Tax increment financing districts, so that if you're getting property tax.
Right. Expanding, we admittedly have not done nearly enough to promote, to get information to Vanessa so she can get it to her members and other groups on the employer child care expenditure tax credit, which is underutilized. So expanding that, but
fact,
doing a better
it
job.
It was used zero, right?
Right. So
Nobody tapped into it.
Exactly.
What was passed and so what you want to do
is expand eligibility.
Is so you can do it not just in-house, but a company could hire a
right.
third party.
And expand the pool of who could use those tax credits as well. Right now it's confined to businesses of 100 or less. We want to expand that to 500. So I mean, I think part of it is expanding who can use it. Part of it is also just making sure that we're talking about it and messaging it correctly so people know about it. But the one thing I did want to hit on just real quick is, because I think it's an important point, is one of the steps that we took during the last budget session were really critical in ensuring that the people that were on, the families that were on the program already receiving CCDF could stay on and continue to receive that funding. So we preserved that funding. It hasn't obviously been expanded.
But the vouchers have been worth less to providers, right? I mean, they're going down.
But the goal, John, is to ensure that the people who need this most can continue to receive the funding that they need to have their children in childcare. We've got to make the fund sustainable, and we can't just kind of go along the route that we were going.
Sam, is this approach, you like this notion that what's in 1177? Again, there's another approach I'll talk about, a bill that didn't get a hearing that another member of the panel authored. But is it all of the above approach, or weigh in on this?
I think Representative Lopez is right. I think an all of the above approach is right. I think Representative Porter had offered a bill around repurposing or redirecting some portion of the state's fiscal responsibility and opportunity growth fund that was passed in the last session.
This was about $300 million, which would address, if I'm not mistaken, the wait list.
Yes. I think that there are pieces, Representative Hamilton, Senator Cadora, I know colleagues in the House and the Senate have all offered different ideas. Representative Heine and his SGO idea for early learning. All of these things are necessary because in this moment, what we actually need is more funds into the system. They don't all have to be government funds, right? They should include some element of the business community. They should include some element of philanthropy, and they probably should include, where possible, some element of family responsibility. But ultimately, this is an issue for providers, as Representative Hamilton mentioned, in terms of being able to create a sustainable system so that they can then provide care for kids and families.
Well, the governor in his State of the State address recently said that he identified this as a very important issue and said he's eager, I think he said, to dig into it in the next budget session, which again is great, but if we've had 200 or some closures already of facilities, and I've heard from a lot of institutions and providers that say, I'm not sure we can make it to a budget session. You're saying this holistic approach may be great, but we need to do something in the short term.
Well, we do. And so I'll point back, Vanessa mentioned the tri-share model that's working in Northeast Indiana. So I've co-authored a bill with my colleague, Representative Dan Chesser. It's her bill. Glad to be a co-author on that. That would expand that tri-share model across the state. That's a proven model that's working right now for families and employers. I also have a bill that, as you mentioned, didn't get a tax hearing, and that's a child care tax credit that goes directly to parents.
Whereas the one would go to businesses that provide the care. Yours, which didn't get a hearing, would have said you get it on your personal
immediately. So
income
families
tax.
know it's coming.
It's a credit.
That's a model that I support, although it's not doing anything right now. This model would immediately help families, and we need that immediate relief. I also want to point out, we've in the last few years, the state has backed up some loans to some facilities across the state to help them expand, build new infrastructure, these high-quality learning centers in our communities that are now they're defaulting on these state-backed loans because of the cuts to CCDF. So it's really short-sighted decision-making that's compounding this crisis today.
Can we afford to wait? Danny Lopez, how do we get from here to the budget year? I mean, assuming that the dollars, we do have a rosier forecast, updated forecast than when things look pretty bleak. But there isn't a desire or willingness to open the budget, which we've stipulated here.
I've been, like some of these folks. I've been in and out of the State House in different roles for 20 years, and I can't remember a non-budget year where there wasn't some urgent need that would call for, hey, we've got to reopen the budget and we've got to take a look at this. The reality is that's not how we do fiscal here in Indiana for a reason, and it served us extremely well. So I think we need to be cautious, and I think we need to be smart about figuring out what are the other levers that we can pull in the meantime as we ramp up to figure out really how you make that program sustainable into the future and take that into a budget year. I think that's got to be the approach, and I think that is the approach that we're taking, and I think we're taking it in a bipartisan way, by the way. I think there's really good ideas on all sides that are going to feed into these solutions. Obviously, you don't want these centers, you hear about these centers that are closing and nobody wants that, and it's creating a shortage, and there's a rash of that too. But also some of these regulations are contributing to this, but these centers also have to figure out how they can be sustainable, not exclusively on public funding as well, right? So we've got to figure out that as well. We can't have centers that are fully reliant on this funding flowing for their business model, because otherwise, again, that's not a sustainable model moving forward.
Vanessa, let me ask you, if 1177 is passed, and I think there's probably a good chance, and the governor signs it, are businesses eager to take advantage? As we noted a minute ago, granted, it was a different kind of criteria and structure for getting the tax credit, but zero of the capacity was tapped. The governor has said, everybody needs to have skin in the game. I presume he's talking about the business community as well. How poised is the business community in Indiana to jump on 1177 and take advantage of it, or anything else that might come down the pipe?
I think we are poised because, again, this is an issue that we hear so much about, and I think that the changes that the bill contemplates are going to allow for that additional flexibility and reach across different sizes of business, and not just go to the business, but also if they kind of contract with a provider or a third party to do those childcare services. I mean, the Indiana Chamber, we did a childcare summit for the first time last November that was really well attended from folks across the state. Again, back to what we've all been talking about, this is a tough issue, and we've got to figure out how we can come together and address it. And I just think that speaks to people being willing to lean in, maybe more or in different ways. And it is also incumbent upon us as the organization that represents all of business to obviously be sharing the great work of, should hopefully that bill will pass and we'll be out there talking about it. There was one other, again, this is smaller, but I think in this environment, we need to look at every opportunity to help on this issue. There's a bill that deals with HOAs and making sure that residents who live in an HOA area can, open up and have a childcare center.
If you meet all the other safety criteria, your HOA can't say we don't want a business in our neighborhood.
Yes.
Or at least that kind of business.
And again, that is just one piece of the puzzle, but back to trying to be creative and think about different solutions.
That raises a question. We've talked about, until you gave that observation, we've been talking mostly about how to solve this with money. We've seen the last couple sessions, there were regulatory changes, maybe lowering the age of people who are providing the care or supervising the care, or allowing unlicensed care facilities to have more capacity, et cetera, et cetera. Is there more to be done on the regulatory side?
I think we're very close to hitting the threshold there. Obviously, we need to be very careful when it comes to providing safe environments for our kiddos. But John, I want to get back to a really important point that Vanessa made earlier about early learning and care. So we know that about 90% of brain development happens in the first 4 to 5 years of life. And so when we're talking about making these investments in high quality childcare, that's really a high quality learning environment for all of our kiddos, which gives our kids a level playing field to start off with a strong education. I think one of the great solutions to help shrink this childcare crisis is to provide pre-K for all. right off the bat, you have 4-year-olds in a high-quality learning, safe environment all day long. And that's a proven investment in those kiddos' futures.
Which has been piloted in Indiana in a number of jurisdictions.
Yeah, and it was also scaled back in this most recent budget. And it's important to mention that the budget that we passed in April was based on a fiscal forecast that was incorrect. We pretty quickly figured out, John, that we had billion more coming in each year that we could have then said, because this is a crisis, we are actually going to do away with the CCDF cuts and the pre-K cuts. We have not done that yet.
Sam, almost out of time. Quickly, do we solve this, or is this something we come back every year? Is it like roads in Indiana? It's never done.
I think any human problem is a problem that we will continue to have to tweak around the edges, right? There are no single solutions because every household and every community has slightly different needs. We will need to continue to innovate on this issue over time, but that isn't to say that the scale of the challenge doesn't mean that we have to absolve ourselves of the ability to dive into it.
All right. Good discussion. Appreciate your input. Important topic, certainly. Again, my guests have been Democratic Representative Carey Hamilton of Indianapolis, Republican Representative Danny Lopez of Carmel, Vanessa Sinders of the Indiana Chamber of Commerce, and Sam Snideman of United Way of Central Indiana. Time now for our weekly conversation with analyst Ed Feigenbaum, publisher of the newsletter Indiana Legislative Insight, part of Hannah News Service. Ed, does anything tangible, significant come out of this conversation about child care this session?
More discussion? No, it seems like we've turned at least one corner, because it used to be that the child care was a social issue and viewed in that context. I think what Greg Porter and some of the House Democrats called human capital, but now it's turned into an economic issue, as you saw by the imperative that Vanessa Sinders was talking about earlier. And so I think that that's really kind of changed and framed the discussion. And even though it seems like we just keep kicking the can down the road, I think you're going to see something substantial in the 2027 budget session.
And part of the reason, perhaps if we don't see anything sweeping this session, it's because there's no time, and it's not a budget session. A lot of stuff is on the table still.
Sure, and we've got a compacted session this year, and we got kind of a late start or an early start. I'm not sure how you'd characterize that.
Both, yeah.
And this week was a very active week for second and third readings, and there were some things on there that came up that I think also weren't really anticipated to be some big issues. The so-called militarization of the Indiana National Guard kind of sucked a lot of oxygen out of the House chamber yesterday, but they've also been really accomplishing some things like a bipartisan utility not deregulation, but really a cost containment measure that made it through the House earlier this week and looks like it's greased to run through the Senate.
See, reminder, don't ever think you've got the legislature figured out. Always some issues that aren't there that come up and surprise you. Ed, as always, appreciate your insight.
Thank you, John.
Is a casino coming soon to a community near you? We'll look at efforts to modify the state's multifaceted gaming industry on the next Indiana Lawmakers. Well, that's it for this week's show. I'm John Schwannis, and on behalf of everyone involved in the program, I thank you for joining us, and I invite you to visit WFYI.org for more State House news. Until next week, take care.
Indiana Lawmakers is produced by WFYI in association with Indiana Public Broadcasting Stations, with additional support provided by Par Ritchie.